Available now is the new DOLA Pro Advanced Prescription for Health Professionals manual. Introducing our recommended 4-step process for easy prescription of the DOLA Pro range that considers patient footwear, foot type and biomechanics, presenting pathology, and lifestyle factors to get the best results for your patient every time. The 4 styles in the DOLA Pro range offer clinicians options to fit the footwear patients want to wear in Step 1. The DOLA Pro Full Length is designed for footwear with removable insoles, including work boots, sports shoes, and walking shoes. The orthotic material is designed for heat molding, grinding, and the attachment of covers and additions. Clinical markings assist with pad placement or accurate grinding. The flat plantar surface and reinforced medial and lateral arch support allows use without glue or reinforcement and will not collapse under loading. This also allows easy attachment of plantar additions, including a rear foot wedge, heel raise, inversion or eversion ramp, and forefoot extensions. The inbuilt 4mm heel raise allows the intrinsic grinding of up to 6 degrees of varus, medial, or valgus, lateral rear foot posts, without the need for additional material. And the forefoot extension allows for cutouts and wedges. Easy fit features including arch and forefoot underskives, beveled medial and lateral waist, and an ultra-thin heel cup assists with footwear fit. Additionally, footwear fit modifications including heel cup height adjustment, medial and lateral taper, rear foot post taper, and plantar grinds are also assisted with clinical markings. Need to fit more challenging footwear? The Pro Fit combines the features of the DOLA Pro Full Length with a reduced plantar footprint and thickness to aid in footwear fit. Designed for popular footwear choices including football boots, casual shoes, street shoes, and narrow-waisted shoes with or without removable insoles. The orthotic material is designed for heat molding, grinding, and the attachment of covers and additions, with the forefoot extension allowing for cutouts and wedges. The flat plantar surface and reinforced medial and lateral arch support allows use without glue or reinforcement and will not collapse under loading. This also allows the easy attachment of plantar additions including a rear foot wedge, heel raise, inversion or eversion ramp, and forefoot extensions. The DOLA Pro 3/4 combines the features of the DOLA Pro Full Length in a shorter length orthotic to aid in footwear fit. Designed for popular footwear choices including business shoes, slip-ons, fashion shoes, those with or without a removable insole, and for those shoes with a narrow or low toe box. The DOLA Pro 3/4 ends proximal to the metatarsal heads. Options include to leave at that length, or add a thin sulcus length cover, or a thin full length cover to maximize the toe box room in the shoe. The orthotic material is designed for heat molding, grinding, and the attachment of covers and additions. The flat plantar surface and reinforced medial and lateral arch support allows the use without glue or reinforcement and will not collapse under loading. This also allows the easy attachment of plantar additions including a rear foot wedge, heel raise, inversion or eversion ramp, and forefoot extensions. The inbuilt 4mm heel raise allows the intrinsic grinding of up to 6 degrees of varus medial or valgus lateral rear foot post, without the need for additional material. Easy fit features including arch underskives, beveled medial and lateral waist, and an ultra-thin heel cup assists with footwear fit. Clinical markings assist with the accurate grinding of heel cup height adjustment, medial and lateral taper, rear foot post taper, and plantar grinds. The DOLA Pro Lite was designed for hard-to-fit and high-heeled footwear, including ballet flats, sandals, and ladies' dress shoes. The flat plantar surface with 3M self-adhesive allows the stable and secure placement of the orthotic in high-pitched shoes. The orthotic material is designed for heat molding, grinding, and the attachment of covers and additions. Popular additions include dorsal pour-on pads, including a metatarsal dome, metatarsal bar, medial or lateral arch pad, or heel pad to help with common pathologies often irritated in this type of footwear. The easy fit design with no heel cup, medial arch support, and 3M adhesive is engineered to allow you to still make a difference in the most challenging of footwear styles. The next section focuses on the most common prescription variables applied to the DOLA Pro Orthotic for patients' foot type and biomechanics, and how to increase this dose, and it is step 2 in our process. The pronated or flat foot is the most common presentation to clinics, with features including an everted calcaneus and lower medial arch profile. Commonly used orthotic prescriptions are explained and include the DOLA Pro plus an intrinsic varus or medial rear foot post grind, a medial arch pad, or rear foot varus medial wedge. The supinated or Pes Cavus foot is a complex and challenging presentation to clinics, with varied features including rigid or flexible joints, an inverted or vertical calcaneus, ankle equinus, higher medial arch profile, lateral instability, and varied toe-off patterns. Commonly used orthotic prescriptions are explained and include the DOLA Pro plus a 4-foot valgus extension, medial arch pad, or rear foot valgus lateral intrinsic grind or wedge. The neutral foot, despite being within normal limits on clinical assessment for foot posture, foot function, and clinical tests, can still present with tissue stress pathology from occupational demands, sports, poor footwear, or an underlying disease process. The characteristics of the DOLA Pro orthotic shell is often all that is required to help this patient, including the stable rear foot, reinforced medial arch, ready to go direct from the packet. The foot showing signs of impaired sagittal plane function at the ankle and forefoot through the gait cycle and into propulsion can be addressed with orthotic prescription. Identified by clinicians in their clinical examination, including ankle range of motion and lunge test, and first MPJ range of motion and JAX test, and in gait analysis, an ankle equinus and functional Hallux Limitus in these patients may present with pathology. Commonly used orthotic prescriptions are explained and include the DOLA Pro plus an additional heel raise or reverse Morton's extension. Additional clinical tests used are explained with links to training videos. This next section outlines common prescription variables added for tissue stress and pathologies, including for the forefoot, midfoot, rear foot, lower limb and ankle, and proximal chain, and includes pathology commonly seen in kids' feet. It is step 3 in our process. The quick view table provides options for treatment-directed testing on your patients or to apply to a DOLA Pro style of your choice. The following pages explain each orthotic variable explained in Section 2 and Section 3. What is it used for? What additions or materials do you use to manufacture it? With video links on how to manufacture on each variable on our YouTube channel. The DOLA range of pour-on and EVA additions and top covers can help you achieve any of the additions previously outlined, including pour-on metatarsal domes, metatarsal bars, heel pads, reverse Morton's extensions, and arch pads, and EVA rear foot wedges, heel raises, forefoot wedges, and wedge strip. DOLA Tech Plate is also available for gait plates and extensions, and a range of top covers for your patient's lifestyle. This brings us to the final step in the process, the selection of the best top cover to suit the patient's lifestyle, activities, and risk status. Often overlooked as a prescription variable, The top cover and mid-layer section is key to getting the best out of your orthotic prescription with a combination of fit, feel and function, our aim in step 4. Options include for those with a risk of foot complications, including plantar tissue stress, hyperkeratosis and ulceration, and the demands of sports and activity, work, and the combination of needs for kids' feet. Want to build your confidence in DOLA Pro orthotic prescription and manufacture? We offer a free online education and training course. Just follow the QR code. Don't have the option to DIY orthotics and need a ready-to-go OTC option? The DOLA Pro patient-ready range of 9 orthotics has been designed to help you fix more of the feet that walk into your clinic every day, with an OTC instant dispense option versus DIY or custom orthotics, giving clinicians an expanded OTC orthotic choice to help more patients with different foot types or biomechanical foot function, for prevention or treatment of more common pathologies, and in a size range covering children to adults, with the aim of introducing affordable prescription orthotic options for more patients into your treatment plans. The patient-ready orthotics range provides an alternative to customs, as the style or prescription is patient-matched by the health professional based on the patient presentation and clinical assessment, with 4 styles designed to address foot type and biomechanics in our foot function range, including the pronation, supination, propulsion, and neutral styles, and 5 styles designed to address tissue stress pathology and complex at-risk feet, including the rear foot, forefoot, medial, lateral, and sensitive styles. Our final section shows the 4 steps of our recommended DOLA Pro prescription process in action in 8 case studies. Step 1 shows the selection of the DOLA Pro orthotic that best suits the patient's footwear. Step 2 shows the choice of prescription variables for foot type and biomechanics. Step 3 shows the prescription of orthotic variables for pathology, tissue stress, or risk status. And Step 4 shows top cover selection for the patient's lifestyle. For a copy of this manual, please email info@dolaorthotics.com or come and see us at one of the conferences.